Welcome. So good to see you. We were having the conversation here, but well, no, we're done. You're live. Thank you for being here.
All right. I'm so loud you probably could hear me anyway, but I am the treatment court administrator for here in Chesterfield County, and Judge Robbins, who is our Veterans Treatment Court judge, a former JAG officer, and of course one of our circuit court judges, is here as always for support and any comments that he wants to make. And then we've got Rondell Davis, who is our peer recovery specialist that works with our drug treatment court, and is also a former graduate of drug court. And she is going to speak when I finish. She's much more interesting than I am. And she's going to tell her story, which I think you all will be very interested in. So, you know, Chairman, board members, Dr. Casey, thank you. Thank you for having me here to just provide you all with an update on where we are with our treatment courts. What are treatment courts? I think you all are aware, I had requested a few months back and received approval from all of you to rebrand ourselves from drug court to treatment courts. And one of the reasons that we did that is because we wanted to kind of stay on the top of our game. We always have been on the top of our game. And nationally, last year, the National Drug Court Association rebranded themselves to All Rise, and then the education and resource and training arm of that institution, which was formerly called the National Drug Court Institute, changed its name to the National Treatment Court Institute. And in keeping with that, at a state level, the Supreme Court has now stopped calling us drug courts and has started calling us treatment courts to more appropriately capture what we do, because we're not just about drug treatment courts. We are about specialty dockets. So they call themselves specialty dockets or treatment courts at a state level.
Isn't the vet court rolled into the treatment court now?
It's a separate court. Yes, we have two of them. So I'm going to skip to this line right here because this might help clarify some. So the Supreme Court of Virginia recognizes three different treatment courts. They recognize drug treatment courts, and there are 59 in the state. And they recognize veteran treatment courts. There are 9 in the state. We just opened our pilot as a pilot in December of 23. And they recognize behavioral treatment courts. You may also hear them sometimes referred to as mental health courts. There are 19 of those in the state. So we are fortunate here in Chesterfield to have 2 of them. Our Chesterfield Colonial Heights Adult Drug Treatment Court opened its doors in September of 2000, so we are moving on 24 years. And our pilot for the Veterans Treatment Court, again, just started in December of 23. We do not have a formal behavior health treatment court yet. It doesn't mean we won't, but we do have services available in the county for those people that are typically targeted for a behavioral health treatment docket. And that is through our dual treatment track at Community Corrections, which you all might be familiar with. Biggest difference between treatment courts and traditional court processing, and Judge, you can add if I miss anything here, but the biggest difference is the judicial monitoring of the defendants before the court. So number one, we have treatment at the table, we have law enforcement at the table, and we have probation at the table. And the right hand always knows what the left hand is doing, and then the judge has frequent contact and engagement with the participants so that he can monitor their compliance with the program and also give kudos where they are moving through their recovery successfully. So if they're not moving successfully and they are non-compliant, they can administer swift justice by bringing them back into court. We are unique in that perspective in that we operate here in Chesterfield as we're not really a separate department, but we're a separate department, but we contract with multiple agencies around the county in order to operate. So all the disciplines are included here. We have a judge that sits from the circuit court bench, one judge that sits for the drug treatment court, that's Judge Pemberton, and one judge that sits for the veteran treatment court, Judge Robbins. There is a Commonwealth Attorney representative on each team. There is a defense bar and a public defender's representative on each team. And when I say team, I mean each court because of the team of people. Community corrections, we contract with them for our probation supervision, and we contract with mental health for the treatment services. We use a police officer. We have got a long-standing, very good partnership with the police department. They're very supportive, and we have a full-time police officer that works with our drug treatment court. And we do not have a full-time police officer for the Veterans Treatment Court, but our population there is such that we don't feel like we need that level of law enforcement. So we actually work with the Sheriff's Department and have a deputy that is part of the team for the Veterans Treatment Court. And then we also, for the Veterans Treatment Court, work with, at a state and national, federal level, Department of Veterans Affairs and Department of Veterans Services that actually sit on our team, come to our meetings every other week, come to court every other week. And that is where the majority of our treatment services are delivered, is through the VA. And we're just starting, so we're still getting our feet wet. After 2 years of planning, we're still just getting our feet wet when it comes to full-blown operations. So we are working with them. Where we have a gap with the Veterans Treatment Services, the CSB or mental health is filling in. So some of the unique aspects, one of them, for our drug treatment court, we are very proud to have a peer recovery specialist, Rondell, who graduated from our program in 2021 from the Adult Drug Treatment Court, started getting her certification while she was in drug court, continued that effort after she graduated. I remember pulling her aside when she was close to graduation and saying, Rondell, we don't want to lose you, please come and be a part and engage when we can. And she volunteered services until she got her certification. Once she got her certification, we were able to hire her through the COSAP grant, and we hired her part-time. And most recently, because our service needs have gone up tremendously in the last couple of years, we just started having her full-time here in February. So she helps co-facilitate and even facilitate some of our groups, engages with all of our clients for advocacy and support. She kind of is the checks and balances on their sponsorships. A lot of times they'll say, yeah, I got a sponsor, and it's just some friend that they just happen to, and she's like, let me meet them, bring them in. So she's our go-to when it comes to lived experience, and you're going to hear from her, so I'll shut up. The Veterans Treatment Court, I think what they call the secret sauce for that and the very unique peer support for that is that we have a volunteer veteran in the community that has volunteered to be our mentor coordinator. And he participates as part of the team. He comes to all of our meetings. He participates in our discussions about the clients, and he recruits veterans from the community to be advocates and resources for our participants, so that each veteran participant will have their own veteran mentor from the community that's going to help them as they move through the recovery process. And that, to us, is worth so much, and we're getting that service free. And I don't know what's happening, but I think probably because of the population that we're targeting, at least once a week I'm getting a phone call or a question, how can I help with the Veterans Treatment Court? And we had an attorney just this week, I just told Judge Robbins about this the other day, that reached out and he said, can I come observe court? Can I come talk to you all? And what he wants to do, when I dug in a little bit further, is he wants to either be a mentor and or he wants to provide some pro bono legal assistance to our clients. So that's a beautiful thing. Some of the services that we hope will reduce no further harm, the whole old saying, no further harm when they come through the system, is the tools, the assessment tools that we use. I'm sure you've heard the saying, right service at the right time. So in order to make sure that you're targeting the right individual, right level of service at the right time, you have to make sure that you're using research, evidence-based, validated assessment tools. And that's what we do. We put a lot of time and energy on the front end to do assessment, to make sure that we know what does this person needs. Part of that assessment is obviously not substance use disorder, but also mental health disorders, trauma, lots, and you're going to hear more about that in a minute, but lots of trauma in the backgrounds, as you all can imagine, in the backgrounds of our clients. We also have upped our game in medication-assisted treatment. And I think the county as a whole has done that really well in the last several years. There's been a lot of education, not just with the community, but with our own staff, and it is definitely an accepted mode of treatment. And we have a lot of use for that, both in the jail, in the community, and community corrections, and mental health, and certainly in our treatment courts. Warm handoffs and swift entry process is huge, and anybody in best practice will tell you that. I am proud to say that I work in Chesterfield County because honestly, our history of successful collaboration is insane compared to other places. I've been around now for almost 39 years, and I'm telling you, nobody does it like we do it. And we have so many projects and so many resources. If they're in the jail, thanks to Sheriff Leonard, they've got all kinds of resources. Not everybody has that. If they're just over at mental health and not even involved in the court system, they have resources. If they're involved in the court system, they have resources at whatever level assistant they are. So we are able, I can't tell you how many times I have texted Sheriff Leonard while I'm sitting in court and said, we're sending somebody your way. You know, can you throw them in HARP for a couple of weeks? We need to get them motivated, and while they're there, get Dr. Gay to do an assessment. We need them on some medication. And then that happens. Never do we get a no. And then they come out of there directly back into the drug treatment court. And those are the things that we're proud of. We also have a nonprofit foundation. Right now it's called the Chesterfield Colonial Heights Drug Court Foundation because we started it back when we only had drug treatment courts back in 2000. I am staff to that board. It is a very small foundation. It doesn't generate a whole lot of money, but what it does do is support some of the things and pays for some of the things that we certainly couldn't use our typical operational funds for. So, for example, if someone needs registration for their commercial driver's license, or someone is trying to take their GED and doesn't have the registration fee for that, or someone needs to get into a recovery house and does not have the money, and the foundation will front them the money, and then they will pay us back when they get a job in installments, and we make sure that they do that. Sometimes we get burned on that, I'm not going to lie, but for the most part, we get that money back. It also helps us with some training for some of our staff. So we are really grateful to them to support. They have also agreed, obviously, to support the Veterans Treatment Docket as well. So we're proud of our services. This is just a list of our services. To be quite frank, you will never really get it until you get it. But we have court either weekly with the drug treatment court or bi-weekly with the veterans docket, and then of course there's 5 phases to each of the treatment programs, and as they progress through the treatment program and move from phase to phase, our contact with them decreases. So we're trying to mirror real life till they get to the very last phase when we're supposed to mirror what real life is about. So we try to transition them. They have a minimum, and I should have put that in bold and underlined, a minimum of 2 drug screens each week, because I would say the majority of our clients are getting at least 3 drug screens. They'll get a couple in the office. We have a police officer that goes out during the week. They'll get a couple out there. So we get a lot. If there's anything particular going on that we feel might be a flag, or we feel like is an issue that might trigger, we will certainly do that. If the probation officer is meeting with them and feels like, hey, there's some issue, and they'll call treatment, or treatment, vice versa, treatment's meeting with them and says they're very upset today, send them down to probation, let's at least drug screen them and talk to them. Individual treatment plans, that's where our assessment comes in handy, because each person, while the phase systems are very similar in terms of broadly similar, their service plans of services are very unique to their particular needs. They have individual and group sessions. They're down at the treatment building at least 3 times a week. And of course, again, we're also doing home visits, but at least 3 times a week, mostly groups, but a lot of individual treatment. And I'm going to talk a little bit about that in a second. We require that they're employed if they owe arrearage in child support, or if they owe restitution. We make sure that we put them on a plan to make sure that that gets that gets honored. And then they are required to do community support group meetings because we want them connected and engaged in the community, whether it's AA, NA, Smart Recovery, whatever, faith-based, it doesn't matter, as long as it's a support group, and that's where Rondell comes really handy. And I think Artie mentioned that. So this, there's no way I can see that, so I'm going to read the numbers right here. So this is just a summary of the last year. When I say the last year, I meant 2022. I did not get 2023. We did over 1,000 drug screens, almost 1,100 drug screens during that year. Of that, only 2%. 30 drug screens were positive. But of those positives, and this will be no surprise to anybody sitting in this room and certainly not in this board, that the majority of those were for opiates and fentanyl, as well as Suboxone that they may have been abusing and not using as a part of MAT. And then this next slide, everybody's always interested in this, and I am going to try to tell the little caveats in this, but we measure recidivism. We can measure it in two ways. What you're seeing here is the measurement for arrest, rearrests. And so I looked at the top category, the top table is rearrest for these are drug court, Chesterfield drug court specific participants that left the program in calendar year 2019. So we were able to look at rearrests in that 3-year period after 2019. And then what we wanted to compare, we wanted to make sure a couple of things. We wanted to make sure that error numbers aligned with what research tells us, and research tells us that some treatment is better than no treatment, successful treatment is better than partial treatment. And so for our graduates that graduated successfully from the adult drug treatment court during calendar year 2019, those 11% of them were rearrested. That is not reconvicted. Reconvicted rates would be much lower. They're not on here because they're a little harder to access. Sometimes their cases aren't even finalized yet, so I did not include any of that. But you can expect that the reconviction rates are lower, obviously, than the rearrest rates. And then for those clients that participated in drug court but were terminated for whatever reason, they, and during calendar year 2019, they were rearrested at 30%. What you see in that right column is statewide numbers. And that is for this data, and you need to take some of this as any data. You need to take it with a grain of salt, particularly when you have two separate agencies collecting the data with two different databases. And so the state is collecting their data. Number one, they're collecting it on a fiscal year. And number two, they do not include show causes, violations, or rearrests for show causes or probation violations or contempt of court. We do include that in error numbers. So, but either way, it proves the second thing, which is Chesterfield stands above the rest in the statewide numbers.
So those numbers don't mean that they had a rearrest for a drug conviction.
No, sir, just any rearrest.
It could be a show cause because they got a parking ticket and didn't show up to court.
Correct.
And that counts in that
Any
number.
misdemeanor
Wow.
or felony. Yep. Yes, sir.
Yeah, we don't filter them out at all. Arrest for anything.
And then the bottom one does the exact same thing, but just in a 2-year period. And so again, that 40% right there, at one point I thought it was higher, but it wasn't. So 40%, we're not as good as the state number right there. But again, the state is excluding a lot that we are including. So I think, but it still goes to show, even those people that participated and were not successful, so they were in the drug treatment court program, might have gotten a new charge, might have just been so non-compliant, might have, just after 8 or 9 months, we ended up having, for whatever reason, to terminate them. And believe me when I tell you, it takes a lot to get terminated. And so even those people fared better than people that had never been in services at all.
Do you happen to have data as to how many of these people have gone through, like, say, the HARP program with Sheriff Leonard?
I do not. I can tell you there's only a handful.
Oh.
that have gone through HARP.
Okay.
There are many that have participated in HARP.
Okay, okay.
Because whenever they go
Yeah.
to jail, even if it's for a drug court sanction,
Yep.
like we're gonna put them in for 6 days or 10 days, we'll say, do y'all have room to just put them in there? Let's get them motivated so that they can come out, because it's whole lot easier to get them motivated when they're in an environment like that 24/7 than it is when they are at home with their families.
You shared that.
I was just gonna say that when I went there to visit, I was just surprised to see, just in the handful of women that I spoke with, 3 of them had said that they denied their bond just so they could be in the program. And so they see it as a value, obviously, and so
Oh,
that's.
very much.
And
But
it's
not
amazing.
infrequent.
Okay, okay.
I don't think that's infrequent, even outside of drug treatment court, just on the regular bench.
Yeah, when I see the regular criminal docket, which is on an order of hundreds, it is not surprising, it is not infrequent to see someone who's participating in HARP that either directs their lawyer right during the hearing, or we find out, as we typically find out, things kind of on the fly, that, no, I'm gonna stay where I am. I have more to do here, and this is a worthwhile place, which is quite frankly in contrary to what is taught to the criminal defense bar, of which I'm a recovering member, which is, the client wants out, it's your job to go for the wall and seek to accomplish that. And so when a lawyer says, never mind, we're not gonna ask for bond, I know that there was a discussion that had to happen behind that. And I wouldn't say every single time, but certainly a great majority of the time, it's somehow connected into HARP. And, the HARP program is not a drug treatment program in terms of like a treatment docket. And that's because of the transitory nature of the people that are coming through, and there's really no guarantees at all how long they're gonna stay, for what period of time. And so it's designed to accommodate whatever treatment can be accomplished within an uncertain time frame. And so it's constantly in motion, it's constantly doing things. And so, at least my experience and the experience of others, I think, is that any treatment that is worthwhile, and there's lots of stuff out there that's not, frankly, but any treatment that's worthwhile is better than no treatment, even if it's partial. And our experience in a treatment docket reinforces this view. And so, although we have a very cooperative relationship with the sheriff, I must see him, if not once a day, more than once a day. He makes a point of coming, and we chat about all sorts of issues of mutual concern. And I wouldn't say we're working hand in glove, but we're working very, very closely. And the HARP, for what it does, is an effective tool. But just like you have a toolbox of hammers and screwdrivers, not every tool works for every job, and not every treatment program that says treatment is worth the paper it's printed on. And so for us, when we are seeing our participants in either the veterans treatment docket or in the drug treatment docket, drug court, kind of marrying up with, okay, if you're going to have to spend time as our guest, you can watch the clock spin by for 10 days and accomplish nothing, or you can make the time count for something and come out. Nobody ever comes out fixed. That's a fantasy that doesn't exist. Can we get you better? And to the extent that HARP is one of the tools, yes, absolutely.
I've heard you say twice now, when you reach out and ask them to go into HARP, they do, but I thought HARP was 100% the participants of HARP determining who goes into the program. Do you have some kind of direct connection to the those that are making the decision for who goes in?
No, none.
Because it's just strange that they make 100% of the decision, but it hasn't been turned down yet. I'm not sure how that works.
We have not been turned down for assistance, so I'll usually ask Sheriff Leonard. He brings it down the ladder, and we just have not. I'll be honest. If the participants that are in HARP are making the decisions, it is very likely they know the participants in drug court. Oh yeah, I know. Yeah. Yes, and so that's where they land. And so even a few days just to be around other people that are in recovery and motivated, and they build some strength, and then they come out and are a little.
I was just curious because I know that's what I've always been told, is that it's 100% run by those that are in the program. or at least decision-making of who comes into the program.
That's true.
And yet they have had 100% acceptance of your request. I just thought that was remarkable, to be honest with you. That's
Well,
why
there
I
is a
asked.
subculture, and I'm going to
Yeah.
tell you now, there is a subculture, and they all know each other. All of our drug treatment court participants, they all knew each other on the streets. I mean, they all, if they didn't know each other directly, there's only a few degrees of separation. That much I can tell you.
Yeah, that is absolutely correct. And so, is a day going to come where they tell us no? Probably. But no, the court certainly has no inside track to cause the participants to make a different decision. But, if you're in the throes of a criminal justice involved situation, as we tell folks, ain't your first rodeo. And folks that are actively engaged in treatment, even when they fail, are crossing paths with many of these same people that are involved in treatment. And so it's not like you're dealing with a complete stranger. And so they complement each other, but no. The sheriff doesn't tell us who goes on the veterans treatment docket, but he's very supportive. The drug treatment team doesn't tell the sheriff who goes into HARP. That's a HARP run thing. We ask for help from the CSB, but assessments drive treatment. As I've indicated earlier, if you don't follow best practices, if you don't let the medical data drive your decision making, if you don't let criminal justice procedure drive how you conduct your business, if you make exceptions because you're trying to achieve a certain result, once you get away from the well-worn path of success, you undo it. And so not everybody who's a veteran gets into the veterans treatment docket. Not everybody who has a heroin addiction is getting MAT. Not everybody who gets arrested for a narcotics offense is going to go through a treatment docket because of the nature of their situation and circumstances. Every case is unique. Every case needs to be properly assessed. And I still come back to right tool for right job. One of the reasons why these things work is not because we pick the low-hanging fruit. The low-hanging fruit, the low-risk, low-need person is not going into one of these programs. They don't need it. There's other things that we can put in place to address this. We pick those people that we can help, for which we have the correct services to meet their need, and that are oriented towards recovery. If the person's not, ready to recover, you lead the horse to water. You're just wasting time for them and you. But for those people who are ready for recovery, at least with the veterans treatment docket, we're trying to leverage your military service. We're trying to leverage resources that already exist at the state and federal level, and we're trying to coordinate those in one setting so that, again, right tool, right job, right person. And so HARP is just, what's the tool, what's the person, what's the job?
And to be clear, Mr. Engel, just to make sure that I didn't misrepresent, I was only speaking, I've never gotten a note for drug treatment court. Not any regular docket or anything like that, any other criminal docket, just when we've had participants in the drug treatment court that are going to be incarcerated for, more than a couple of days. If we call over there, they're usually very accommodating.
And I'll follow up with that in terms of, we will get requests for programming in the context of dispositions of cases. When it comes to HARP, that's between the sheriff and the inmate. We don't order it. That's between the sheriff and the inmate. If somebody wants to do HARP, they think that's the secret sauce for them. As we said, we'll take anything that works. That's not something that the court orders, but it's certainly something that when somebody's successful or participating well, the court certainly recognizes, even in a traditional setting. But no, that's the sheriff's thing.
We're working hard, with treatment court, with HARP, with, mental health, even our schools on their recovery academy. And I think what we're trying to see and get for everybody, for transparency's sake, is the data is showing itself. Like the recidivism is just one statistic, but there is a certain duration you need to be in these particular programs for the effect to occur. and some need to be contained within a jail facility. But whether it's the recovering housing topic that you're going to hear more about, or all these other programmatic services that Chesterfield's trying to do and trying to lead, you know, the rule book hasn't been written completely. We're actually writing this, and we're using the data we have to, and again, we're finding exactly this duration factor and the peer-to-peer counseling secret sauce that exists of those that are local peer-to-peer counselors talking to people that they had once known in a different light possibly. So I hope at some point in time we can bring almost this whole array of services and programmatic paths, because, you know, the treatment court unfortunately is one path from a judicial standpoint. Ideally, we're trying to be in front of that, so that how can we help people out in the community that are falling prey to this terrible addiction that's out there.
I think not to get off topic, but the Opioid Abatement Authority, the projects that we have going on with that, but again, like you said, we're on the very front end of that. That's going to be very helpful in terms of all-inclusiveness. So some of the challenges, and we have had challenges in the last several years, and a lot of them have to do, well, what the bullets will say. The criminal justice reform has definitely impacted our census. Since 2020, our census has gone down. There are two probably biggest reasons for that. Some of that is criminal justice reform. Some of the new code changes have limited the ability to impose certain sanctions, limited the judge's hand on imposing some of the sanctions, and sometimes it's easier. This is a voluntary program. It's easier. People will say, I'd rather take my chances in court and through the traditional process and get out of here and go do my thing. And then we also have, the Public Defender's Office came, and they have been part of it, one of our partners. They are trying to work with us and collaborate with us as they can. But, just by the nature of who they are, they're going to always be on the other side of anything that has to do with keeping somebody in the system a little longer, whether it's for treatment or anything else. And so that has kind of, because they handle so many of the cases that come through the court system, that has limited the number of referrals. Now, what I'm going to say is this. What we're seeing in terms of a decrease in census, we're seeing across the state. And it has been going on. I mean, all of the drug treatment courts are experiencing this. Some have even, a lot of them are experiencing this. And so I think we're going to see this trend become the norm. I just do. But what we've also seen is while the census has gone down, the service need has gone crazy. And so the intensity of the population that we're dealing with in terms of treatment has increased. I cannot tell you. In the last couple of years, we've added 3 new treatment groups. We have, I used to, when I would talk about drug court, going to Rotaries, talking in the community, talking here, and I used to say 65 to 70% of our drug treatment court participants have a mental health disorder, another mental health disorder as well. 95% right now, 95%. And that's a lot of manpower necessary to treat that. Trauma scores are insane. We spent, just last week, 4 staff, 3 hours with one young lady who's probably the most fragile background, tragic background, trauma background, and heavily fentanyl to hell, except that there's an angel that she has not passed. And those are the type of people that we're dealing with. Our individual counseling, we do a lot of groups. Mostly with adult treatment, you do more groups than you do individual. You start out with individual till they're ready for groups. And so they will always have multiple groups in a week, always. But our individual counseling, we would start out at the front end weekly, and as they move and progress through the program, every other week they come to individual counseling, and then as they get closer to graduation, once every 3 or 4 weeks, in addition to their group work. We are seeing these clients every week individually, and some of them twice individually through their entire tenure in the program. And that speaks volumes in terms of what we're seeing in terms of their level of service need. So we, same amount of staff, fewer people, huge burden on manpower in terms of providing service. we're also, because we had a lower census, we were like, well, let's broaden our target population. So now what we're doing is we're accepting people with longer criminal histories and more criminal minded people. If you've heard of the criminogenic factors, more participants that have more criminogenic factors in their background. And so what we're seeing is public safety issues, obviously, and higher risk people. So we've always taken the medium to high risk and need. We're probably on that continuum, and if you've seen a continuum, which I've showed you guys before, of level of service needs versus risk, where they're at in the county, because the county has needs at every level. Low risk, low need, we have something for you. As you move up that ladder until you get to incarceration, we still have things for you. And the treatment courts are that piece right before incarceration. And then fortunately in Chesterfield, even incarceration, we have some treatment services available to you. And so we're just seeing the level of intensity, it's just been mind-blowing. It really has been mind-blowing. So we're dealing with that, and then of course, I don't think this will be a surprise to anybody that we have more lethal drugs being used. So high fentanyl, high heroin. I mean, heroin is like nothing anymore. It's the fentanyl and the other opiates, and that's what's killing everything. And
I would simply say, just as anecdotal, and of course anecdotal evidence is lousy evidence to make any decisions, but I'll share mine. You know, I've been a judge for over 20 years. And when I started this work, people dying from overdoses would be so infrequent that it was an enormous event, once every 2 or 3 years. And in the time that has elapsed since then, you know, then it was once a year. Then it was a couple times a year. They bring me my work every day in a shopping cart. Literally, they push a buggy down the hall, and in that buggy is all the work for the day. If it's not once a week, it's once every 2 weeks. I am signing a probation release order for someone who has overdosed after having gone through court and while on probation and in treatment, and they've overdosed and died. And it's happening so frequently that if it, like I said, if it's not once a week, it's once every 2 weeks. Sometimes it's a couple in a day. And, you know, not that you can make any decisions based on that, but if my little experience of my shopping cart over time is any indication, fentanyl is going to be the undoing of the community. And these are people who are receiving treatment, who are under supervision. I have no idea what the fire department will tell you what they're using for Narcan out on a given weekend at the local filling station. But this lethality is real. At least my experience is that it's very real.
So I am going to close by saying, and because I'm very cognizant of you all's time, and I know you still got a huge afternoon and evening ahead of you, and I want you all to be able to talk to Rondell. I can sit here and talk until tomorrow. Until you have come and seen it, it doesn't click. So Dr. Casey and Dr. Worsley have both participated in both treatment court sessions as well as graduations. You all are welcome anytime. I will make sure that you get all the information of when we meet and you know, so that we'll know when you're available. We also have a graduation ceremony coming up in 2 weeks. Wednesday morning at 8:30, we have 2 participants from the drug treatment court that we will be celebrating their successful completion of drug court. And they have been in the program for a long time, but when you have long-term needs that have been brewing for years and years, it takes a little while to get to the root of that. So we would welcome your participation and observation anytime you want. Again, I'll make sure you get all my information so that you can do that. And we'll do that, Dr. Casey has asked me, just on an ongoing basis. Whenever we have a graduation, we'll make sure that you all know. I just want to say thank you. I want to turn this over unless you've got a pressing question that can't wait until after, whatever, either way you guys want to do it, but I want y'all to be able to hear her story
Yes.
before you finish
Thank you.
your afternoon.
Yes, please.
So, good afternoon. My name is Rondell Davis, and I'm just so proud to be a part of this team, to be a resident of this county, like Miss Meadows said, and nobody does it like Chesterfield. Absolutely. And so just thinking about the long road traveled, right? For me to even be here today with you in this moment, right? It's overwhelming for me. And I'm just overwhelmed with gratitude. Doesn't even seem like a big enough word, right? So I'm going to tell you how drug treatment court allowed me to recover, refocus, and rebuild my life, right? So I'm going to give you a little bit of like what it was like before, during, and what it's like now, just a little bit, right? So before drug court, right, I was, it's a long list of adjectives I could use. I was broken, I was lost, I was shattered, I was insecure, I was isolated, I was trapped, right? My life was a hamster wheel, like a Groundhog's Day experience, the vicious cycle of doing the same thing over and over, expecting different results. And addiction had did a great job of ravaging my life for over 30 years. Right? And it was so much evidence of it right in front of me, but I couldn't see it. So the evidence was the broken relationships, because I manipulated, I lied, I took advantage of people that loved me the most. It was always some type of emergency going on in my life that I needed to be rescued from financially. Just constant neediness and couldn't take care of my own needs. Numerous felonies, 15 years incarceration total, in and out, in and out. The poster child for that recidivism printout that she just put out there, that's me. Numerous documented and undocumented overdoses. And once my life was spared, yet again, I did the same thing over and over. I remember wondering, am I insane? And then I would later learn that insanity was doing the same thing over and over, expecting different results because I couldn't see the truth. So by the time I reached the last house on the block, which is my nickname for drug treatment court, I was so beaten down by consequences and poor choices, I knew I was close to the end of the road, not rock bottom, because it seemed like my bottoms always had trap doors, because I was so deep in denial, and plus I had a network of people around me enabling me. So I find myself all alone. My family was done. By the time I got to drug court, my family was done. My mom looked straight through my soul. She was like, only God can help you. She threw up her hands. So here I am at the last house on the block, 50 years old, 117 pounds, 3 new felonies on top of the 11 previous convictions, and I'm given this opportunity. So while I'm detoxing at Riverside Regional Jail in this dark, smelly cell, the fog was lifted from me just long enough for me to get a glimpse of what my life really looked like. So now I can see what everybody else is seeing. and I do not like what I see. And I cringe at the chaos, the unmanageable, the complete mess that my life had become. And it was so much power in that moment, because it was then that I realized I need help. I surrender. So my surrender, and I'm sorry, forgive me. So my surrender actually made the program simpler. Not easy, but simpler, because I had made a decision that this is what I'm going to do. I followed directions. I was desperate. I was willing. I took suggestions. And my clinician, Mr. Bullock, he challenged me. We dug deep. We did the hard, uncomfortable work. I was vulnerable. And my biggest challenges, thank you, were coming up against, thank you, my own antiquated belief systems, distorted thinking patterns, and hardwired survival techniques. All of those things were keeping me stuck. And they were no longer serving me. So my clinician and I'm so grateful for him, it was like peeling back the layers of an onion, like a blooming onion, like the ones they have at Outback. Those big onions where. And so along with the individual sessions with my clinician, we also had group therapy. So in group therapy, I'm learning time management, money management, coping skills, problem-solving skills. There was an MRT workbook that helped look at my moral compass and how my addiction affects everything that's connected to me, indirectly and directly. And that was like a spiritual awakening, realizing how this was affecting my kids, society, my health, my work relationships, everything. It was like dominoes. Drug court was introducing me to me. I was growing, I was learning, I was being stretched, and I was being restored to sanity, because now I can really see the truth. So doing a session with Mr. Bullock, and I don't have much longer, a very difficult session where we had processed some grief and loss. He said something to me. He said, "You're unstoppable." And I heard it. And I possessed it. And I took it literally. And I knew that I had the tools and support to accomplish any goal that I wanted to accomplish. So here we are today. So my clean date is July the 19th, 2019. I have 4 years, 7 months, and 2 days clean. I have a sponsor, a home group, and a whole network of truth tellers that hold one another accountable. My relationships. My sponsor asked me, "What do you want out of recovery?" I said, "I just want to be able to sleep at night." That's it. That's it. And I have been able to give my mom that gift, my grandmother that gift, my children that gift. My financial restitution, my court costs, my fines, my debts that were in collections, all of it is completely paid off. My credit score is in the 700s, never been there before. I'm a registered voter, had not even been interested in doing that before. All of that has helped me become a productive, responsible member of the community and society. And there's a twist to my story, which Ms. Meadows already told you. So when I learned that I was unstoppable, I set some goals for myself. I took a risk, did a lot of praying. So I completed my training and required hours for peer recovery specialists, which drug court supported me every step of the way. And this is after graduation. I'm no longer in the program. So once I became certified, I became registered with the Board of Counseling. And now I am the full-time registered certified peer recovery specialist for Chesterfield, Colonial Heights Drug Court. The same program that introduced me to me helped me see the truth and gave me the tools I needed to clean up all of that wreckage. What a gift. What a responsibility. What a baton I have been passed to help somebody else. This is important work. This is very important work. The face of substance use disorder in my experience, in my day-to-day job, is getting younger and younger and younger. Judge Robbins was talking about closing out cases once or twice a week. I have a huge network. Narcotics Anonymous, Alcoholics Anonymous, Smart Recovery, Recovery Dharma. My phone rings every day. And I'm hearing about somebody that I know that's gone. Every day. And so, like I said in the beginning, gratitude just doesn't seem like a big enough word. Thank you for your time.
So this is what we aim for when we do it right. I mean, we're trying to hold the people before us accountable. We're trying to engage them in services, address the issues that brought them before us, that led to the behaviors that brought them before us. And if we do it right, we can contribute to safe and secure community, healthy families, public safety, giving people their world back. So,
Supervisors, comments, please.
Rondell, thank you so much for your vulnerability and telling us your story, and for finding yourself and helping others find themselves as well.
Thank you.
You might have to pass that tissue box back around. I know it takes a lot to find yourself, and sometimes you don't like what you find, but to actually have the fortitude to move forward through that anyways and break down that wall that you've built up around you takes a lot. And then to share that with other people and help them to do the same thing, because they need to hear it from someone that can do it, because the people that they don't believe that it can be done, a lot of them.
Yes.
And if they don't see somebody that's done it,
Yes.
they don't believe whoever they are talking to. So having somebody that's been through it, walked a mile with them, and understands exactly where they're at and broke through the wall makes all the difference in the world. So thank you for your work.
Thank you.
Dr. Miller.
So in the interest of full disclosure, I've spent the last 25 years as a drug treatment counselor. I am certified as a substance abuse counselor. My doctorate's in clinical psychology, so I'm also licensed as a professional counselor. A question for Judge Robbins in that, what do you contribute to being the change with regard to what feels like a spiraling out of control, for which I am not going to disagree? So I'm curious to know about that.
Not being a trained mental health professional, I'm a recovering lawyer, as I indicated earlier, which means I do everything half-baked. For everybody, it's a little bit different. One of the things that makes a veterans treatment docket work is just like a person who has looking at the front end of recovery needs to see somebody who's at the other end of it. Most veterans see military service as like skydiving. Either you've done it and you know what you're talking about, or you're just some idiot who thinks they do. And so they're not going to listen to somebody with anywhere near the attention as they would for somebody who's walked a mile in their shoes. And so I think part of the reason why this works is we try to bring that sort of thinking and that process to bear. But I think every participant, whether it's in a drug treatment court or whether it's in a veterans treatment docket, they certainly have commonalities and overlaps. But for everybody, it's kind of a little bit different. They sort of have to find their own motivation, and our job is to sort of assist them in getting a hold of that. One of my participants committed some behavior which, quite frankly, was utterly humiliating. If I had had to have a discussion with my adult daughter having done the exact same thing, I would rather have crawled under the table and bashed myself into unconsciousness. And so for that individual, hitting bottom was being so humiliated by their own misconduct and having some desire to try to regain their own sense of worth in their circle, both their family and otherwise, that they were prepared to do just about anything to get there. But that only worked for that one individual. Everybody else has their own reasons. As we've heard, rock bottom has a trap door. And it does. And eventually people get to the point where they're exhausted. They're driven by external drivers. If recovery was just a matter of just say no, we would have done it already, right? And if you could confine your way to sobriety, there'd be one judge on the floor, not six. You can confine your way to abstinence, but abstinence is but one step on the path to sobriety. Recovery is hard. You know this. It's physically painful. It's extraordinarily time-consuming. For some folks, it's extraordinarily humiliating because you have this facade you present to the world that you have to punch through to get to the ugly life you've been living underneath. And so when a person finally gets to the point of the axle has fallen off the hamster wheel, they just can't keep all the balls in the air anymore, and they've reached a point where the better path is recovery, then you can start the hard work. Treatment dockets are designed to bring to bear both the carrots and the sticks. The carrot is you get your life back. I can't tell you the number of times when I used to do this work with juvenile drug court when we had that. Parents are like, I have my kid back. I said, happy to be of service. Welcome to Chesterfield. But I can't give you a singular answer for how it is that people finally get to the point where they turn the corner. For everybody, it's a different point on that spectrum of difficulty. And frankly, sometimes we don't find it.
Right. I was going to say that the question I'm asking is that everything that I'm able to tell is that we are, as a culture, have kind of spiraled out of control. And as I'm seeing it as a drug treatment counselor and as a professional, as a mental health professional, what I'm noticing is that there was a really interesting article this morning in the New York Times where they kind of give a monthly kind of summary of news. And they were talking about how suicide in England for years in the 1800s was occurring all the time. And then all of a sudden it kind of dropped and they couldn't figure out why. And what it had to do with was the fact that people lost having an ability to commit suicide because they didn't have access to gas any longer. And so they weren't putting their heads in ovens any longer. And therefore, suicide dropped precipitously. And their point is that access, and I've realized this is not something that we're able to do here
Right.
on the county level, but that access to guns has been a primary methodology for suicide, especially with veterans, because veterans die at an alarming rate of 19 veterans per day die by suicide. What this is all, for me, you kind of put your finger on it, which is shame. Shame is one of those feelings that is so uncomfortable that what ends up occurring is we just don't want to feel it because of what we've done. And so ultimately, drugs is a wonderful way of avoiding shame. However, it's an empty.
Right.
I mean, it just
It's a time-limited,
it doesn't work, and it's for a short period of time, and then we're off to the races again and again and again, and it becomes cyclical. Ms. Davis, you put your finger on it, which I thought was beautiful, is that the whole concept of surrendering isn't about giving up at all. It's about joining the winning side.
Absolutely.
And once you get that through, but I had a question for you. You pointed to it a couple of times, but you said a couple of times about knowing the truth. The word you said is there came a point was that you couldn't see the truth, and then there came a point where you were able to see the truth. So I'm curious to know, what's the truth?
Wow, that's awesome. So the truth is, I am not my experiences. I am not my past. I am not what I have been through. Those things have shaped me and molded me, and I have overcame those things. And I do believe that a lot of things that I have gone through is to help somebody else. It's to be able to identify, it's to be able to be compassionate, and to be able to assist and guide other people to find their why, that you were talking about. I'm reminded of a tale where this young man was walking down the street and fell in a hole.
Exactly.
Yeah, he fell in a hole. And so a pastor walked by, and he looked down and he said, "What are you doing in that hole?" He was like, "I fell in the hole." And the pastor prayed for him, and he was like, "Okay." Gave him some scriptures, and he left. And so somebody else walked down the street who was a clinician. He was like, "What are you doing in that hole?" He was like, "I fell in the hole." And he gave him some homework assignments to do, and he left. And then it was a psychiatrist who walked by and was like, "What are you doing in that hole?" He was like, "I fell in the hole." And he wrote him some prescriptions, and then he left. Then a peer came by and saw him in the hole. And the peer jumped in the hole with him. And he was like, "Why did you jump in this hole? Now both of us are in this hole." And the peer said, "I've been in this hole. I know the way out."
That's right. That's right. I've heard a story very similar to that. We walked down, and actually it's not mine. I wish I could say, but the story is I walked down the street and I fell in a hole, got myself out of that hole. I walked down the street and I walked around that hole.
Yes.
And finally I figured it out. I walked
Yes.
down a different street.
Yes.
And and that becomes the process of learning, and we are
Absolutely.
not our mistakes, we're not our experiences, but the truth is, and this is what I have been working toward myself, is that the truth is that everyone we connect with, everyone, is sacred and worthy and luminous, sacred, worthy, and luminous beings. That the essence of who we are is love, and that our love is forgiving. And what I really connected with what you were saying is the word unstoppable. That ultimately it's about forgiving, taking that love of essence of who we are. And that essence is love. It's forgiving. Forgiving other people and forgiving ourselves. So thank you for all the work that you all are doing. It is truly sacred work. Any way we can support you, please. I look forward to being at the graduation. I asked Susan to put me on that list. One other thing I just want to kind of make a point on is that we keep forgetting that trauma, okay?
Yes.
Trauma is equal to aggression, okay? Is that we were the recipient of aggression, and that somehow that's our fault. And letting ourselves, forgiving ourselves, it wasn't our fault. So we can go on forever. We'll continue the conversation.
Thank you.
Thank you.
I'm gonna take
Supervisor.
that with me.
Yeah, thank you. Supervisor Engel and then Carol, Supervisor Carol.
So, I was thinking about the hole analogy, and seems to me that when you're in the hole, what you really need is people to keep coming by and bringing you a little bit of dirt, so you could keep stepping up a little bit until you fill the hole, and then you know how to fill the hole for somebody else. And so,
I love
sounds like that's what happened. Is you've had, if you bring all the dirt at one time, what are you gonna do? You're gonna bury the person, right? Can't do
Absolutely.
that. You gotta bring them a little bit at a time so they can keep
Collective.
stomping it down and coming up out until there's no more hole. And it sounds like that's what you've done, and you help other people to do.
Thank you, Supervisor.
you.
Supervisor Carol, are you there?
Mr. Allen, I don't think I could even begin to touch the quality of the comments
Yes, sir.
that you all did. I absolutely appreciate everything that they've shared with us today, and certainly for sharing her story, and wish all of them the best success in the future. Thank you.
Thank you, Supervisor
Thank
Carroll.
you.
And I just want to say, Ms. Davis, Ms. Meadows, and Judge Robbins, I thank each of you for being here today and for sharing your experience. And one thing you say is that you heard, and once you heard, the light triggered and change occurred. So we congratulate you, we thank you, and we appreciate all the great work you're doing. Ms. Meadows, understand you're retiring,
Yes, sir.
and we are gonna miss you, but we thank you for the difference you made. You made a comment that Chesterfield does it well or better.
I'm very
And you're
proud.
part of that.
Thank you.
And so we thank you for what you've done and the difference you've made, and we will desperately miss you.
Thank you very
But come
much.
back and see us sometime
Oh, I will.
when you like. Thank you each again, and all the best to you. Blessings upon each of you in all your work and your efforts. Thank you.
Thank you.
Thank you for your support. Appreciate the time today.